My topic will be on brain health, on food for thought, on what you and everyone can do to reduce your risk for dementia and to maintain your brain health. So our brain is one of the most vital organs of our body. Although it only weighs about 3 pounds, but it does marvelous things for us. It creates memory, it drives our emotion, it controls our behavior. It's really one of the most fantastic supercomputers that you can ever imagine. So our brain works 24/7. Our brain never sleeps. It's vitally important for all of us to truly take care of our brain. Just like our bodies, our brain also age. As we get older, so our stature is not the only thing that shrinks. Our brains do the same. So you can tell here that this is a younger gentleman and this is an older gentleman. As we get older, we get shorter, our skin starts to sag, so do our brains. So our brain slows down in terms of the speed, and it's becoming a little harder to learn new things, to remember names, to remember different things. And our brain become a bit more vulnerable to disorders such as Alzheimer's and cancers and stroke. And then we are starting to experience more of those senior moments. Don't we all sometimes, right? You walk into a room, you say, I remember that person, but I just cannot come up with the name really at my fingertip. So I think that is part of the aging, but that doesn't mean that we are suffering from Alzheimer's. Speaking of aging, we know that we are, not only just the United States, but the world in general are marching into the aging society. As of last year, in January, we are entering into truly the aging society. In January last year, that every day there are 10,000 people in this country turning 65 every day. And this will continue for the next 19 years. So as of last year, there are over 42 million people in the United States are over age 65. In another 20-some years to come, about 25% of the population in the whole United States will be over age 65. This graph showed you the projection of the aging population, or the growth of the aging population from 2010 to 2050. You might be able to see here that particularly in the segment of age 85 and older, there will be substantial growth of people in the next 40 years to come. So we are having more older people, more requirement in our society as to how, not only that we're going to be exercising our body, but how we can exercise our brain so that we will have our lifespan to match our brain spans. Here is just some examples showing you that by 2050, there will be about 14 million people in the United States who will be suffering from Alzheimer's. And the cost of Alzheimer's is more expensive than the cost of cancer or the heart disease. So by 2030, then the total cost of Alzheimer's globally is going to be over $1 trillion. So we really cannot afford not to tackle the Alzheimer's, not to tackle the dementia. That's exactly what we are doing here. We are doing many, many clinical trials to looking for a way how we can treat the disease, how we can diagnose the disease, and how we can actually prevent the disease from happening. So here is some examples of our Alzheimer's clinical trials currently being conducted at the LouRuvo Center for Brain Health. We are addressing various stages of Alzheimer's, from the most severe stage to the mild to moderate state of Alzheimer's. And we are very excited about 2 brand new clinical trials currently we are doing. We are treating people who have no cognitive impairment. We are treating people who have no memory problem. So those are what we call the prevention study. So I have my team here, and that they are working diligently to recruit people who are what we consider at a high risk of developing Alzheimer's, yet they have no symptoms. So that there are some experimental drugs that we are looking at how, by giving those drugs to people at a higher risk, might prevent them from developing Alzheimer's or might reduce the risk of them getting Alzheimer's. There are many types of clinical trial currently we are doing in the centers. The reason I'm talking about the clinical trial is that despite all the effort, overall, we have no cures for Alzheimer's. In the last decade, the failure for the drug development is about 99% in Alzheimer's. So it's depressing in a sense, isn't it? We are working very hard, but in the next 5 to 7 to 8 years to come, it's unlikely there's going to be a cure for Alzheimer's. There is going to be a breakthrough treatment for Alzheimer's. So at the same time, what can we do? What can you do? What can everybody do? So people are looking at prevention. People are looking at, on the day-to-day basis, are there anything that you can do? You can be more in control to reduce the risk of you getting Alzheimer's, of your loved ones of getting Alzheimer's. The good news is there is a lot you can do, okay? So there are many risk factors for Alzheimer's. Age, obviously, is one of the very important risk factors for Alzheimer's. Family histories, gender, and genes. In the left-hand side of the column, those are what we call the non-modifiable risk factors. Those are the risk factors really you have no control. You have very little control over. So as Mark Twain said, you have to choose your parents wisely because you cannot really do much about it. But at the same time, on the right-hand side column, there are many things that you actually can do in an effort to reduce risk of Alzheimer's and dementia, from controlling the diabetes, controlling the hypertension, get more educated, stop smoking. Here is a chart showing you that almost over 50% of what I have just talked about, the modifiable risk, are within our control in an effort to reduce the risk of Alzheimer's. Isn't it exciting? So 50% of the risk factors you actually can potentially have control. That is your lifestyle. That is within your control. So what I'm going to tell you a little bit in the next 20 minutes or so is a very exciting program here at the LouRuvo Center. We're just about to launch. So that is our brain health initiative. This is really truly the first time ever that I'm actually speaking publicly to a group of audience about our brain health registry. So I am very pleased that you are my first group of audience. So the core foundation of the brain health initiative is our 6 pillars of brain health. You probably have heard a lot of information, went to many lectures, read books, went online and talked to your friends. There are all pieces of information coming, what to eat, what not to eat, how to exercise, should I practice online game, so on and so forth. Sometimes people feel it's information overload. So what we're doing is we have conducted very extensive literature search. We have talked to experts in the field across the country, and we have put together what we consider a very easy and doable 6 pillars of brain health that you can actually practice on the regular basis. So the 6 pillars consist of physical exercise, brain fitness, food and nutrition, social interaction, sleep, relax, and controlling other medical risk factors. First pillar is physical exercise. Get moving, that's what I tell people. There are ample scientific evidence showing that get moving, get active physically can significantly reduce the risk of dementia and Alzheimer's. By getting physically active, you can actually increase the blood flow, not just to your heart, but to your brain as well. It improves the memory. It also would enhance the overall learning processes. It reduces stress. It helps you with sleep as well. So there are many types of physical exercise people get engaged, and you don't have to be a bodybuilder, you don't have to be a triathlete to be physically active. From walking, jogging, you can do gardening, tennis and golf, and yoga and Tai Chi. They're all important exercise. There are many, many evidence showing different kind of exercise have benefit to your brain and to your overall brain health. The goal of the physical exercise is that we would love to have you to improve your endurance, to strengthen your overall muscle as well as your bone, to push the limit, to be flexible, and balance is another very important element that a lot of people tend to ignore. Our balance actually reduces significantly as we are aging. Starting from age 45, every year it reduces about 1 to 2%. So that, lack of balance is a high risk of fall, which is a high risk of fracture, and you know what happened after that. So balance is very important. So what we have advised our people is that you can walk backwards, you can walk sideways, and you can stand on one toe, and that's a very important, very simple that you can do on the day-to-day basis. Flexibility, Tai Chi and yoga, we advise people to do that about twice or 3 times and about 20 minutes each time. Weightlifting is another very, very important. You don't have to do heavy weightlifting, but it's very important to do strength training, keep your bones strong, keep your brain strong. In terms of a cardio, the American Heart Association guideline is as follows. Here is a simple formula depending on your age. So it's 220 minus your age times 80%. That will give you the target heart rate. So when you exercise, when you go to the gym, or when you walk, depending on your age, you can calculate what will be your targeted heart rate. So when I give lecture in one of the retirement community, quite a few people raise their hand and say, we are 95, then what is our heart rate? So I say, good for you, keep on walking, keep on moving. So it's so one thing that I think people need to keep in mind is we have understand quite a bit about what's good for our heart, isn't it? In the last 10, 20 years, there are a lot of information about heart health, but what is good for your heart is also for your brain. So that's easy to remember. Okay, whatever practice you have really engaged in, do that. That's also good for your brain as well. So the second pillar is brain fitness. There are about 50 million Americans use gyms. Okay, that's quite a high number. So they want to go and get their heart rate up, they want to do the weight training, and they take care of their body. So the question is, what do we do to truly take care of our brain? What kind of brain fitness, what kind of brain exercise we should be doing? Keep this in mind. Brain is just like your muscle. You use it or you lose it. All right, so keep on using your brain. There are many, many ways how you can keep your brain active. By doing that, you're actually building what we consider as a brain reserve or cognitive reserve or intellectual reserve. That is your brain's capability of adapting to changes and to fight and fend off the stress and damages. So the more you learn, the more you keep your brain active, you're actually building your brain reserve, which is very, very critical. So shut off the autopilot, learn something new, okay? So either been a skills, a language, dance class, cooking lessons. If you are right-handed, try to use your left hand. drinking the water from the left-hand side, brush your teeth. So those are different exercises people can get engaged to help to stimulate their brain and to stimulate the growth. Here in the center, we are also working with different brain fitness games program, from DACM to Lumosity to Brain HQ. Some of you may be familiar with some of the program, crossword puzzles, reading newspapers. Coming here for lunch and learn is a great way of getting your brain engaged and active. By being here today, you actually help to stimulate your brain and keep your brain healthy. And one of the slogans we really want to advocate is to stay active and stay sharp. Keep your brain sharp. Food and nutrition is another critical element of the overall brain health. We truly are what we eat, aren't we? So we do that at least 3 times a day. And sometimes we do that mindfully, other times we don't. With regard to the overall literature on the relationship between brain health and diet, the Mediterranean diet is so far the one that truly stands out. There are many meta-analysis, many clinical research, scientific findings pointing to the benefit of Mediterranean diet. The definition depends on the region and also depending on the literature, because if you're looking at the Mediterranean diet in Spain versus the Mediterranean diet in Italy, it actually may vary slightly. But overall, the concept is such that you should have a high intake of vegetable, nuts, and moderate intake of the fish and the olive oil and some whole grains. Very low intake of butter and red meat, which is actually interesting because a lot of people think red meat is really bad for you, but there are also some literature suggesting that the Mediterranean food actually does include a very small amount of red meat. So the key here is really moderation. That is very important. We all drink, either being water, coffee, tea, or wine. Red wine has been shown to have some benefit to brain health because that one of the active ingredients in red wine is resveratrol. There are some evidence showing that the resveratrol has a very strong antioxidant. Is a very strong antioxidant. It can actually reduce the formation of the amyloid plaque in the mouse model, and it also has shown that the in a small study, resveratrol has some benefit in the overall memory and the motor skills. But this is inconclusive. That a recent study on resveratrol, which we participated, has shown no effect on the overall memory. So there are ongoing studies looking at the overall benefit of resveratrol as well as the red wine. But again, the wine can be an important part of your lifestyle. Moderation is important. Okay, coffee. Coffee is one of the most popular beverages in the world. There are about 400 billion cups consumed in the United States each year. Interesting studies show that about 3 cups a day in the age group between 65 to 85 over the course of 3 months actually did show the improvement of the overall memory and learning skills. Okay, but it's very critical to keep in mind that when you add sugar, when you add creamer, when you go for that big grande frappuccino, that kills the whole effect of the black coffee. All right, so really it's truly just black coffee has the strong antioxidant and has some benefit on the brain health. Similarly with tea, there are many types of teas. Green tea and black tea have been shown to improve memory in a small sample of the patient population. Keeping in mind both tea and coffee are stimulant, that if you drink excessively, that can disturb your sleep pattern, that can get you very fidgety, that can perhaps increase your stress level. Again, coming back to the point that is truly moderation is very important. Let food be the medicine. So this is something we eat every day. Keep in mind what you put inside your body and how that can help with your overall memory. We are currently conducting some internal research. I would like to get your help. One of which is we are in the process of creating the Cleveland Clinic LouRuvo Center for Brain Health, healthy brain food from A to Z. Okay, so literally from the apple to start, to berries, to a variety of food down to letter Z. I actually have a printout that Susan is going to hand out after that. I would love you to fill out in that each letter what you think will be the brain healthy food. And then we will post this on our website when we are going to be launching this brain health initiative. So the more the merrier. So I would love to get your input on our food category to support the brain health initiative project. So it's not really just the food, but it's really the way how we enjoy our food. The Mediterranean diet is not just a diet, but it's a way of living. It's a way how you eat your food, it's the way how you savor the taste, and it's the way how you enjoy dining with your friends and family. Supplement, I think that's one of my favorite topics. A lot of people always have a question about the supplement. What should I take and how much and how often? The overall scientific evidence on the supplement and brain health is inconsistent. If you take a look at the literature, there are literature for vitamin E, and there are also results against the vitamin E. But there are enough evidence suggesting the combination of vitamin C and vitamin E might be of some benefit. The other major category of the supplement, of course, is omega-3 or fish oil. How many of you are taking fish oil omega-3? Few, okay. For those of you who do take that, you know there are many, many different varieties out there. And it can be somewhat confusing in terms of the information for the consumers. So it is important to read the labels of your supplement. So omega-3 is an essential fatty acid our body do not produce, so we need to take that either from the food or from the supplement. Fish is a very important source of omega-3, and then particularly salmon and tuna. If you are not a fish eater, then supplement will come in. If you love fish, the recommendation is approximately 10 to 12 ounces per week. So that's about 3 times a week for the fish. And if you do that, you actually do not need to take the supplement of the fish oil omega-3 because that's plenty. About 3 ounces of the salmon will give you about 1 gram of the omega-3. However, if you don't, then you need to supplement. So the omega-3 has 3 forms. That is DHA, which you probably have heard about, and also it has EPA. It also has ALA. So the DHA and EPA can be from the fish, but the ALA is only coming from the fruit and flaxseed and walnut. The usual recommendations from the WHO is that you should take approximately 1 gram of the omega-3 on a daily basis if you do not eat fish. There is a caveat to that because the omega-3 can also be a blood thinner. Okay, so if you are taking medication, you are taking blood thinner, you should really talk to your physician, and then the dose of the omega-3 need to be adjusted accordingly. You always hear news, you know, omega-3. Another question is about coconut oil. You know, it's been in the news lately. So coconut oil is a MTC, it's mid-chain triglyceride, MTC. So that is a substance that can convert to the ketones. In the patient of Alzheimer's, the way how their body metabolizes the glucose, the sugar, has been impaired. so that the supply of the sugar to their brain is being impaired. So the MTC is an alternative energy source to their brain and to their body. There is very little large-scale clinical study or trial looking specifically at the coconut oil per se. So there have been a lot of anecdotal studies. But interestingly, there is a type of medical food that's sharing the same kind of chemical structure. It does belong to the mid-chain triglycerin category, and that is currently available in your doctor's office, however, requires a prescription. I have a sample here. There's no conflict of interest, by the way, I'm declaring that. So this is called Oxona. So it's a type of medical food. So medical food is different from supplement, and medical food is different from a prescription drug. However, this still requires the prescription from your physician. Currently, it's being used to treat Alzheimer's patients and people who have mild cognitive impairment, rather than as a substance or supplement to enhance memory. So that if people want to take something to help them to improve the memory when they do not have any underlying pathology, this is truly not indicated. The staying active, staying connected with your family, with your friends in the community, again, is a very important element of the brain health. So that's our fourth pillar. It provides support, it reduces stress. A study by Harvard University examined about 2,200 volunteers, follow them longitudinally for about 4 years. Those who have been actively engaged in their community, either being church, some other activities, have shown that the overall progression of their memory impairment is much, much slower compared to those who were not participated in the social engagement and social activity. Pet is also very important. So treasure your loved one, including not just your family, not just your children and your family members, but as well as pets. So many of you may have known that this is Jordan. This is our Cleveland Clinic pet. And I think Jordan actually is here today. So every Wednesday, Jordan is here. You know, Jordan, we call Jordan our therapist. You know, Jordan greets our patient. Jordan is the icebreaker. Jordan just brings smile to our patient, to our family members. And I think that pets do that to you. There are many, many studies looking at the benefit of pets on your overall mental health, on your overall heart health, as well as the brain health. There is actually a very good brain health guide that as part of the reference. Susan, you may want to share that with the audience after the meeting, so that it actually listed a lot of important tips what you can actually get engaged on a day-to-day basis to help with the brain health and the overall practice. So this is actually my dog, and his name is Teddy. And Teddy and I were in my office looking at how we can create the brain health 6 pillars. So he is my companion along the way. The 5th pillar of the brain health is what I call really the R&R. So rest, relax, and sleep. We know that the stress, sleep deprivation are major risk factors for the cognitive decline. Let's just think about when you have jet lag, when you are sleep deprived. We know that your mind don't function that well, right? So you really need to have adequate hour of sleep. The study indicated that the optimal hour of sleep is between 6.5 to 8 hours. Okay, so there are a couple of publications recently looking at a group of people. They have followed people for about 4 years, looking at the benefit of sleep, the overall sleep pattern, the overall quality of their sleep. For those who actually slept somewhere between 6.5 to 8 hours, they have the optimal mental acuity, they have the optimal performance level when it comes to the memory, their motor function. It's a little easier just to say than being done, isn't it, to get a good night's sleep, particularly as we are getting older. But here are some interesting tips about how you can get engaged in a routine in order to facilitate the overall process to get a good night's sleep. Keeping physically active is important. For people who take frequent naps during the day, as you can imagine that the overall sleep during the night will be impaired. Getting enough sun is very important because that tends to regulate your internal system, the melatonin system, so that you know how when we have the jet lag, that's one of the problems, isn't it, when you go to a different country. Keeping the weight down, the sleep apnea is another major deterring factor for people to get a good night's sleep. Keep it private, and a lot of people watch television, a lot of people go on their iPad, a lot of people look at their iPhone before they go to sleep. There are some studies now suggesting, very interesting, because of the blue light emitted from the electronic devices actually interfere with your internal body system, so that although you should go to sleep by 10 o'clock, 11 o'clock, but the light is still bright in front of your face, that interferes with your sleep. So the recommendation is you can read a book, you can read newspaper. It's actually much better for you than reading off an iPad. But again, it's a very early on the study, but keeping that in mind, that might be something that you might consider not to do before you go to bed. There are some other risk factors which can significantly increase the chance of getting Alzheimer's and dementia. Hypertension, high cholesterol, head injury, obesity, depression, and smoking are some of the major risk factors which are very well documented. For people who have diabetes, there are studies showing that those who are having diabetes, who are not well controlled, they have as high as 4 times a risk of developing Alzheimer's down the road compared to those who do not have diabetes. So that brings up to another issue, that is the sugar consumption and obesity. Getting your weight under control is not just good for your body, but for your brain as well. Head injury, so wearing a helmet is important. You know, people who suffer from head injury either intentionally, that is in the case of the boxing game, or unintentionally the football players and a motor vehicle accident. Longitudinal scientific studies have shown that there is a clear association between the head injury and their memory impairment. So it's very important to protect your head. So I have talked about the 6 pillars, and to help people to remember that easily, here's something we came up. That is, for the physical exercise, we call that get moving and get going. So get off the couch. To keep your brain sharp, get engaged with various kind of activity to build up your brain reserve, and eat smart, and you will think better. Stay connected with your family, your friends, your pets, and rest well, get a good night's sleep. And finally, to do what you can to get your medical condition under control to reduce the risk of getting a dementia. So we're really marching into an aging society. You know, years back, 10 years back, it used to be about 30-something young couple with children in the suburban area. But now, it's about 60-something, 70-something and more. You see all the celebrities, you know, they're frequently appear in the ad. So as we call that, silver is bold. Silver is everywhere. So those who actually understand and prepare a world that's aging will win the battle. So I hope that you all will come on board and fight the battle and stay engaged and engage into a brain healthy lifestyle. And really to keep your brain sharp. So memory is really a way of holding on to the things you love, the things you are, the things you never want to lose, isn't it? So by getting engaged in the brain healthy lifestyle, you're doing yourself a favor to keep your memory alive for yourself, for your children, and for many generations to come. So we have the Cleveland Clinic LouRuvo Center Brain Health Guide that I think Susan will distribute to each and every single one of you. And I'm happy to announce that we are working diligently. In January next year, we will be launching a very interactive website. It's the Cleveland Clinic, the Brain Health Initiative website, in which that we will be providing you some of the information that I have briefly touched upon today. But more importantly, we want to get everyone engaged and involved. One of the cool programs is that it's very much of a customized program. So we will deliver a series of questions. You will answer based on that. We will be able to calculate what we call the Brain Health Index Score, the BHI. Many of you probably have heard of BMI, right? So nobody has heard about BHI. So this is something we are currently developing. It's going to be a Cleveland Clinic LouRuvo Center proprietary information. You will have a score, and then that is the composite score of your lifestyle, of you as an individual. And then we will be providing what we call a customized recommendation based on your response to the questions. Then we'll be helping you to get engaged in exercise and to eat smart, eat better. And then you can actually track how you're doing online. And then the idea, the goal is that you can actually improve your brain health index. Isn't that cool? And we have many, many people involved, from the technology, from the content development. The AARP is very involved. And then I just spoke to Mayor on Saturday. I was sitting with her at one of our functions. She said, I'm so excited. And she said, I can get 5 mayors all involved to support the program. LVCVA is involved. So that I'm very happy that today is the first time I'm able to share with all of you about our new initiative. So stay tuned. I would love to get each one of you involved to sign on. And then you can be our first pilot study participant if you wish. All right. So on that note, I'm going to stop and I'm going to open the floor for questions. Yes, ma'am. Thank you.
I didn't understand. Should we be using coconut oil or not?
If based on the current available literature, if you are not suffering from any memory problem, and if you do not have any medical diagnosis of dementia or Alzheimer's, it's not recommended. Because the benefit, I am a scientist by training, so that before I prescribe anything, before I get engaged with certain lifestyle changes, I need to understand what is the evidence supporting that. Yes, there are anecdotal evidence, there are frontline news, there are some individual studies showing the benefit of coconut oil. But what we have not seen is very systematic research looking at the benefit of those who actually use the coconut oil and compared to those who do not use coconut oil. It's an individual decision, but again, that coconut oil can be good in terms of it's a moisturizer in a sense, right? It's good for your hair, it's good for your skin. People tend to use that as a moisturizer, but also we have some patient reported they took the coconut oil, then they started to have a lot of GI symptoms, diarrhea. So everybody's different. It's really difficult to make any recommendation. As a matter of fact, we cannot make scientific recommendation without the evidence. Yes, ma'am.
You mentioned
luminosity and brain age cube, and you said there was a third one, and I didn't catch it.
DAKIM, D-A-K-I-M. That's another company, yeah.
I use coconut oil.
Yes, ma'am.
Can you speak to gluten and brain function? Gluten?
Gluten and brain function. I'm sorry to say that I really don't understand too much about the gluten. I know there is a very large number of people who are engaged in the gluten-free and the carb-free and some other free diet, you know, like vegans and vegetarians. So that there are evidence showing that the high sugar content, you know, the carb actually convert to high sugar, and the high sugar is detrimental to the brain health. But in terms of the actual study linking the use of gluten or the consumption of gluten to actually the brain health, and he said that I'm not quite aware of that. If you have any feedback, I will be very open to that. Yes, ma'am.
You had a slide that you went by that said turmeric and ginger.
Yes.
Is there anything you can share on that?
So the question is the benefit in turmeric and ginger, which was shown on the slide. I skipped that slide because the image didn't come through. So I'm glad you brought that up. So the turmeric is really curry. It's an antioxidant, and really the initial observation was based on the difference between the dementia incidence or prevalence from the Indian population compared to the population here. So as we know that the Indian tend to consume much higher curry than we do, so they have about 40% less dementia there compared to what we have here. There have been subsequent studies looking specifically using the curry in different settings. The result is somewhat inconsistent because one of the reasons is that we cannot just give the curry powder to the trial participants. So it has to come in a tablet or capsule or gel. The overall manufacture of such is not under FDA's regulation, and some of the capsule that's used in the clinical trial later on was found that it did not cross the blood-brain barrier. So that if it didn't actually get into your brain, that we doubt what kind of effect that might be. In fact, the curry itself, it was shown that it did cross the blood-brain barrier. So that there's still some ongoing study looking at the exact benefit of such.
And ginger?
Ginger is inconsistent. Ginger is inconsistent, but again, you know, when you look at the 5,000-year history of the Japanese and Chinese cuisine, that ginger has been a very important component of their food, of their cuisine. And there has been some evidence showing ginger is anti-inflammatory. It's good for your heart, it's good for the arthritis, and then there has been some speculation that ginger might also be good for your brain, because Alzheimer's, one of the pathology is really the underlying inflammation. So anything that has something to do with anti-inflammatory might be benefit to your brain.
Thank you.
Okay.
Let's
All right.
see if there's any questions in alcohol.
Oh, pardon me. So alcohol? Good. All right.
She has a question.
Oh, she did. I couldn't see them.
It's on mute. We can't hear.
Seeking possibly curry. So she just was wondering about the curry. You were saying that in the Indian people they had 40% less dementia. Is that what you said?
Yes, that's
and that the real food was better than the supplement.
something to that effect. So the 40% is based on two studies. That's not a countrywide study. So that in the selected samples, comparing the Indian population with the Western population, that was the number that was published. Well, thank you all. If we don't have any more questions. Thank you.